Hello, I'm Dr. Chris Adelman of the Addiction Pros, a group of physicians devoted exclusively to the prevention and treatment of alcohol, nicotine, and drug addiction. With over 40 years of experience, we know few can lick substance abuse by themselves. For most, it's a long and arduous road that takes trained physicians and counselors, educational materials, and support groups like AA. One of the main problems today is that there's simply not enough money available to train professionals, addicts, and even family members with the state-of-the-art training materials required to turn the tide against substance abuse. At the Addiction Pros, we've created a series of highly effective training DVDs aimed at behavioral medical professionals, addicts, and their families. We cover the gamut of the addiction spectrum from alcoholism through prescription drug abuse. Following is a sampler of these offerings, which we know can make a difference. For full information on this new dimension in addiction and recovery training, please visit our website at www.theaddictionpros.com.
Pain management in addiction and recovery. Pain is a common occurrence when dealing with addicted patient populations and can be an extremely challenging situation. Additionally, more and more addiction and mental health providers are being asked to assess chronic pain patients to determine whether or not they have addictive disease. This presentation discusses acute, chronic, and malignant pain, how to assess pain and addiction in patients, and how to approach the treatment of pain in patients with addiction and those in recovery. Medical comorbidity of addictions. Patients with addictive disease frequently present with medical issues that require evaluation by chemical dependence and mental health providers. These medical comorbidities can be patient-specific or drug of choice specific. In this presentation, we review many of the more common medical comorbidities that cluster with addictive disease and discuss why the specific medical conditions present challenges to treatment providers and patients alike. Detox update. Medically supervised withdrawal from various drugs of abuse is an ongoing challenge for inpatient and outpatient treatment providers alike. Frequently, physicians, addiction treatment providers, and mental health agencies are confronted by challenges when attempting to help patients stop their drug abuse patterns. This presentation will outline regimens to assist in the detoxification from alcohol, benzodiazepines, barbiturates, opiates, and stimulants. Nicotine dependence, a challenge to addiction and mental health providers. Nicotine dependence is the #1 killer in America, and patients with other mental health or addictive disorders have a much more difficult time quitting and a higher prevalence of smoking than any other group in our society. This presentation reviews the current level of nicotine dependence, the factors that maintain some degree of tobacco use in our communities, the physiological and pharmacological effects of nicotine, and strategies to help address this large public health and individual health problem. Prescription drug abuse. A substantial and growing part of the spectrum of addictive disease in our society involves prescription drugs. This presentation describes the characteristics of controlled drugs that cause them to be classified as scheduled drugs by the FDA and the DEA, the patterns of prescribing behavior that contribute to prescription drug abuse, and the patient characteristics that result in abuse. By understanding drug factors, physician factors, and patient factors that propagate this abuse problem, solutions for safer prescribing become clear. The neurobiology of addiction. The knowledge about the brain mechanisms of addictive disease is increasing rapidly and beginning to be useful in treatment planning and patient care. This presentation summarizes current knowledge and explores future research efforts that are promising to advance future knowledge. Addiction Overview, Parts 1 and 2. Addictive disease is very common in our society. Many misconceptions exist about the nature of addictive disease, who is at risk to develop a substance abuse-related problem, and what the causes and effective treatments are for addiction. This presentation provides discussion of the definitions of substance use, substance abuse, and addiction, review of the etiology of addiction, and the reasons for current approaches to addiction treatment. Learning about opioid dependence, Parts 1 and 2. Opioid or narcotic abuse and dependence is one of the most rapidly increasing addictive diseases. Much information exists on the risk factors, natural history, and treatment of opiate addiction. This presentation discusses the causes, course, and treatment of opiate dependence. Learning about alcoholism, Parts 1 and 2. Alcohol abuse and dependence is one of the most long-standing and common of addictive diseases. Much information exists on the risk factors, natural history, and treatment of alcoholism. This presentation discusses the causes, course, and treatment of alcoholism.
For full information on this new dimension in addiction and recovery training, please visit our website at www.theaddictionpros.com.